Teratogens, what not to consume when you're pregnant.
The word teratogen in Greek means monster forming. Teratogens are agents that interfere with normal development of an embryo. Many things can be listed as teratogens, and some are more serious than others. Exposure to some teratogens, even in trace amounts, can have devastating effects.
Alcohol.
Oh, it's been such a long day. I think I'll have a beer. Life's so stressful. Oh, being pregnant's so stressful.
When a pregnant woman drinks alcohol, so does her unborn baby. There is no known safe amount of alcohol to drink while pregnant, and there also does not appear to be a safe time to drink during pregnancy either. Therefore, it is recommended that women abstain from drinking alcohol at any time during pregnancy. Prenatal exposure to alcohol can cause a range of disorders, known as fetal alcohol spectrum disorders. One of the most severe effects of drinking during pregnancy is fetal alcohol syndrome. Fetal alcohol syndrome is one of the leading known preventable causes of mental retardation and birth defects. If a woman drinks alcohol during her pregnancy, her baby can be born with fetal alcohol syndrome, a lifelong condition that causes physical and mental disabilities. Fetal alcohol syndrome is characterized by abnormal facial features, growth deficiencies, and central nervous system problems. Caffeine.
Oh, I'm so tired, but I have so much to do today. I have a meeting and I should just grab a coffee and caffeine.
Caffeine crosses the placenta to your baby. Although you may be able to handle the amounts of caffeine you feed your body, your baby cannot. Your baby's metabolism is still maturing and cannot fully metabolize the caffeine. Any amount of caffeine can also cause changes in your baby's sleep pattern or normal movement pattern in the later stages of pregnancy. Remember, caffeine is a stimulant and can keep both you and your baby awake. Numerous studies on animals have shown that caffeine can cause birth defects, preterm delivery, reduce fertility, and increase the risk of low birth weight offspring and other reproductive problems. Lead.
I think I'll do some painting. Lead-based paint. I always wondered what paint tastes like.
Exposure to lead is common. Lead is used in batteries, metals, paint, ceramic glazes, cable covering, ammunition, and recently, toys from China. Pesticides, paint, and gasoline had enormous amounts of lead until the dangers of lead were more fully realized. Old homes may have lead in the tap waters as it seeps from leaded pipes. A fetus whose mother is exposed to lead runs a developmental risk of being spontaneously aborted, being born with a low birth weight, being born prematurely, and developing skin tags or other abnormal markings. A male baby is also at risk for undescended testicles. Tobacco.
Being pregnant is just so stressful. I think I need a cigarette. Did you want some?
Exposure to tobacco is, of course, common through smoking cigarettes or otherwise ingesting tobacco or being the recipient of secondhand smoke. At a minimum, 10% of U.S. women smoke while pregnant. The risk to a developing fetus whose mother is exposed to tobacco is that the placenta may not develop normally, causing conditions like a placenta previa that can cause severe complications, including death during pregnancy and/or delivery. The fetus is also at increased risk of developing heart defects and being born at a low birth weight. Babies that do not survive are often difficult to comfort and are sometimes described as nervous or jittery. Babies that continue to be exposed to tobacco through secondhand smoke after birth have increased risk of SIDS, asthma, and other lung-related problems. Mercury.
heard all fish is really good for you when you're pregnant, so I'm just going to eat fish every day.
Mercury is a shiny silver metal that is in liquid form at room temperatures. Exposure to mercury might happen around broken thermometers, denture fillings, broken fluorescent light bulbs, and eating fish that have high levels of mercury, especially swordfish, shark, king, mackerel, and tilefish. A fetus whose mother is exposed to mercury could be in serious danger. Mercury can stop the duplication process of cells and lead to the death of the fetus. It can also alter the cells as they divide and introduce a variety of unpredictable mutations in the developing fetus, especially to their nervous system.
Made by Claire Bridgeforth, Maya Yaney, and Andrea Lonkey.